Welcome to Humanizing Healthcare, where we talk with innovators and thought leaders who are working to make healthcare experiences more compassionate and rewarding for all. Our host is Chris Malone, founder of Fidelum Health and author of the award-winning book, The Human Brand: How We Relate to People, Products, and Companies.
Hi, I'm Chris Malone. Welcome to this episode of Humanizing Healthcare Live. We are coming to you today from the International Patient Experience Congress in Riyadh, Saudi Arabia. I'll be your host for today's discussion, and I'm happy to welcome to our program Qadar Zada, the Chief Operating Officer of IMC, International Medical Center. Welcome to the program,
Thank you.
Zada.
Thank you so much, Chris, and thank you for giving me the opportunity to come and speak to you today.
It's our pleasure. I'm wondering if you could start us off with telling us the story, or if there's an experience you can share about how you came to have a career in healthcare. What brought you to this?
Yes, this is really interesting, actually, because my background is in computer programming. So I started off as a computer programmer at the time when I was trying to understand where I wanted to take my career. And at that age, to be honest, it's really hard to make a decision like this. So I went along with some of my friends at the time, and we went and studied computer programming. This is the pre-2000 boom, if you remember. And when I got my first job in computing, I didn't really enjoy it. I missed the human interaction. So I decided then to see which other opportunities were. And I was accepted on two management training schemes. One was Fast Track Police Management Training Scheme, and the other one was the NHS Management Training Scheme. To be honest, I can't recommend this enough. It is the best program I've ever done. And it was a graduate scheme where they gave me the opportunity to learn in a hospital and work in a number of environments, but also the opportunity to study at the same time and develop skills and develop business. So it was an absolutely amazing program. And I think it still runs now exceptionally well. So that's how I ended up. But alongside that, I started, as I said, in the presentation, I took some interest in politics and started to look into social care and politics around that. And as I said, also studied a CIPD for human capital management and organizational development. So really my career that started off initially wasn't necessarily intended to be in health, but I missed people. And as I got into health, I realized that there was something I could do that would add more value than just sitting in front of a computer.
We have a fascinating background with so many different facets of expertise, from computer science to administration to human resources and so forth. And we're so fortunate that you made the choice that you did to come and make the impact you are in healthcare. Now, you also mentioned your presentation earlier today was very compelling. I was wondering if you could tell our listeners who may not be familiar a little bit more about IMC and some of the initiatives and programs that you have going on there.
So the International Medical Center is the state-of-the-art hospital and built on a range of values that are much deeper than a business. So they're based on the values of wellness. They're based, even the way that it is designed is intended to improve your health. So how the room is organized, where the light comes in, even when I said in the presentation, what we feed you, what we talk to you about, what we offer you to drink, it is all intended on promoting and improving your health. Whereas I know that some organizations may feel that they work solely for the health bit. We're offering a complete solution, not a solution in terms of this is it, but able to assist you to return back to good health. So it's an offer that was very, very unique, which now, as it's grown and it's outgrown in its popularity, we're now trying to replicate the same model. And we've recently opened our facility in Mecca, which is the holy city in the kingdom. We're looking at a further hospital open in the north of Jeddah. We've got an outlet opened in the Red Sea Mall. But the principle we're working on is not only treating you well, but you're eating well, you're playing well, we're focusing on sports recovery, we're drinking well. So it's a wellness initiative, which is very, very unique for a hospital, because hospitals usually focus on illness rather than wellness.
That's a great point. And it seems to be a very kind of comprehensive and holistic approach to it, that we're not, treating illness, we are fostering health, essentially.
Well, the mission statement of the chief executive, who is a renowned speaker on the subject of wellness, Dr. Waleed Fatehi, is about a unique approach for the body, mind, and soul. So he's not only focusing on repairing somebody's body or helping them to repair their body, but it's about how we help you on body, mind, and soul, and fostering divine standards. This is our mission statement if you went away and researched it.
When you share that context, it helps me realize why the other thing that I found so compelling about your presentation is a part of it, and that is that you are measuring things more than just clinical. You are focused on measures like trust that are more about the mind and soul. I was wondering if you could tell us a little bit more about that and how that came about.
Yeah, I mean, when I was asked to do a presentation here, I wanted to focus more than just patient experience, because I think traditionally people have seen patient experience as completing a survey, and you return the survey, and most people are looking at whether the survey says that you're good, bad, or indifferent. What we're looking at is building a relationship and a partnership with the patient that's built on trust. And the reason we see this as so important is that the moment the patient enters the hospital, they're doing it on the basis that they entrust us with their health, and they expect us to deliver based on our expertise. So this is not a short-term interaction. We're looking for a long-term partnership. And as I explained, what we're interested in is firstly making sure you are well all the time. But should you feel, unfortunately, unwell, we want your stay to be as minimum as possible, and you recover as quickly as possible. And then we help you transition to your home, because most people will recover in hospital, but actually the environment that they're in and the other stresses may not assist their recovery. So we extend our arm into your home. This is the purpose of our home health service. We want to then make sure you're well. But then we want to make sure that if you interact with other activities, that we can make sure you keep yourself well during that. So, for example, the Red Sea Mall. We know that people will visit, go out and visit and shop and stuff like that. We want to be there to assist you. So we're taking healthcare to you rather than you coming to us. We're also very interested, for example, in sports, because we know that one of the reasons that people can fall ill is their inactivity and physical inactivity. So we want to make sure that when they do take this activity on, it's in the safest possible way, and they can do it in a way that doesn't harm their health further. One of the reasons why we set up a facility in that one of our recent facilities in the Paddle Clinic.
You mentioned a number of things there that I think are really important and compelling. Among them was the focus that you have on building a long-term relationship. And I think particularly in the Kingdom of Saudi Arabia, as it moves towards privatization, there is both an opportunity and a risk. The opportunity to have greater financial control and efficiency, but also the risk that we've seen in the United States that care experiences, as they become more digital and focused on efficiency, can start to feel robotic or transactional, or become like a transaction. And the fact that you are focused on building and measuring and creating lasting relationships, we have found that's really what drives care engagement and outcomes. And so I think that was really valuable.
Yes, I think also, look, the digital age is moving and moving rapidly, and AI is moving at pace. So we're not here to hold people back. We're here to complement. And the last lecture that Dr. Waleed did at the last year's patient experience was entirely about how AI can complement health rather than be an obstacle to health or even replace health. We realize that most people want to use their phone, whatever, to do most of their activities in life. And we shouldn't get in the way of that. But we also recognize that there are some interactions in life that, alongside the digital, the interaction with the phone or whatever, you want that to be complemented with a conversation with somebody, because you can ask those questions. And the one thing that the digital phone or the app or whatever cannot give you is empathy and compassion. And this is why I focus so much on empathy and compassion, because how you build trust with people is not by giving them good access to services or good quality food or a good building or to access or all the other things, or they have a good park. It's that ability to talk to them on a level that is empathetic, compassionate, and understands where they're coming from.
It triggers the emotion that creates trust and loyalty.
Absolutely.
And that can't be done through most devices.
And we're laser sharp on trust being the source of our communication rather than experience being the feedback that we receive from patients.
Very well said. Very well said. There are many younger professionals here who are wanting to grow and learn in their careers, maybe even aspire to those kind of role that you have. What advice or guidance might you offer to them, given the experience you've had in your career?
Well, firstly, I would say this is a contact sport. So you need to be able to want to be in contact with people. And one of the things I said to you earlier is I moved from my career in computers to people because I enjoyed the interaction with people. So the first thing you have to be clear is that you want to have that interaction. You have to have a desire and a set of values that means that you want to do good for people. And this is not the sort of business that you can go into and think that you can interact with 1, 2, and 3, and you'll get the outcomes. It's a fluid job. I mean, chief operating officers are the coordinating point between, the medical profession, the nursing profession, the IT. We're the ones that bring them all together. Our job is to sort of execute the strategic direction of the organization into operational deliveries and actions, follow them through, make improvements. But we don't want to just deliver based on what we're told to deliver. We want to be also a contributor. So you have to want to do something and you have to want to contribute to improving health. I can tell you, the International Medical Health Center has the best patient feedback in the Kingdom of Saudi Arabia. It goes into in Press Ganey, when you look at Press Ganey, it's 90% plus. So it's in the top quartile. We could sit back and say, well, we're doing well, we'll carry on as we are. But no, what we've moved our experience to trust, because we believe that we are not in this business just to get good experience and good feedback and that's it. We're in this business to build a relationship so that when people come to see us in IMC, they go back and they say, you can go to that hospital and they'll treat you, but you can trust IMC. And that's what we want to build. So my advice to people is you've got to have to want to do this. You need to have an eye for strategy and a vision as a chief operating officer, but you need to love the detail. Because if you don't understand the detail, what will happen is that you'll follow a strategy that won't necessarily deliver results. And by the time you've got to the end of it, you've missed the opportunity. So it is, and this is why some of what I talked about was the analytics and the data that drives the decision making. And you have to want to also be somebody who's willing to experiment, accepts failure, has a certain level of confidence that you think, well, okay, I'm prepared to make this decision. You need to be able to work with different professions and different mindsets. So, for example, you want to be working with IT, whose focus might be IT, and how you can use that expertise into the operational. You want to be talking to finance about how their priorities can align. So this job is in effect the glue to people, really.
Well, that's very, very good advice. And I think your approach on relationships and trust is wise counsel for career management as well. That in the end, just as it is with these patient relationships, it's our success source in our careers as well.
Well, one of the things that I say to my staff regularly, that in time we can teach you most things. But no matter what we do, we might not be able to teach you trust, because actually it's a value base. And if this is not your value base, then no matter what I do, like I said at the panel the other day, you can't say to a group of people in the morning, I'd like you to go and be nice to patients and accept and expect them to do that throughout the day. It's either in the value base or not. You may be able to offer them the tools, offer them the support, give them some further expertise to enhance it, but they've got to want to do it. So my advice would be, you've got to want to do this to make it a success.
And that's what makes a difference.
Absolutely.
That's what makes a difference. Qadar Zada, it's been such a pleasure to talk with you. Thank you for sharing your wisdom with us. Thank you to our listeners as well. Be sure to join us for another episode of Humanizing Healthcare Live, here from the International Patient Experience Congress in Riyadh, Saudi Arabia. Until then, be well.
Thank you.
Thanks for listening today. If you enjoyed this episode of Humanizing Healthcare, please give it a rating, share it with others, and follow us at Fidelum Health on LinkedIn. And make sure you join us next time as we share more insights from another inspiring healthcare leader and innovator.